So today we're going to be going over just the basic anatomy of the knee. So real quick, a couple of anatomical terms. We talk about proximal being closer to the head, distal being closer to the foot. Also, we use superior or inferior for those terms. This is a right knee that we're looking at. We know that because the fibula is over here. So we have the femur, the tibia, and the fibula. Other terms we like to use is anterior, meaning closer to the front, and posterior to the back. So anterior, posterior, proximal, distal. So the first structures we see again are the bones, the femur, tibia, and the fibula. Then we have the quadriceps tendon here, the patella, and the patellar tendon. So the extensor mechanism consists of the quadriceps tendon, the patella, and then the patellar tendon. That helps us straighten our knee. Removing the patellar tendon here, we can see inside the knee. So we'll talk about the cruciate ligaments now. So there's two cruciate ligaments. They're called cruciate because they cross. You have the anterior cruciate, so that's the one in front. That's the one we can see depicted here. So that runs from the femur to the tibia, and it prevents anterior translation of the tibia. That's because it's the anterior cruciate ligament. It's anterior and prevents anterior translation. The PCL, or the posterior cruciate ligament, we can see it crossing back there, but we can see another good depiction of it here, and that prevents posterior translation of the tibia. Then we have the collateral ligaments, or those are the ligaments on the outside. So we have the medial collateral ligament, the one on the inside of the knee. It's big and broad and long. And we have the lateral collateral ligament, or the LCL. Others call it the FCL, or the fibular collateral ligament, because it attaches the fibula and the femur. So these medial and lateral ligaments prevent side-to-side translation, or what we call varus and valgus, whereas the cruciates prevent anterior and posterior translation. Then the last structure in the knee that we'll talk about are the meniscus and the cartilage. So the meniscus are these fibrocartilage discs that we have in the knee. There's a medial and a lateral one. They attach to the bone anteriorly and posterior to the root. So there's an anterior root and a posterior root. And they provide two key important functions to the knee. They're a major shock absorber to protect the cartilage, and they're a secondary stabilizer to the knee. So in a knee that is ACL or PCL deficient with more translation, these meniscus now see more load and are more primary stabilizers in that type of knee. Then the last structure is the articular cartilage. It's the smooth, shiny surface on the end of the bones to help with a near frictionless environment to help the knee glide back and forth easily. So there you have it. There's the basic anatomy of the knee.